A sore throat is one of the most common infections we'll experience, affecting most people at least once a year. Although normally harmless, it can interfere with our day-to-day lives and in some cases might need medical attention. Today I'll outline the causes of a sore throat, the symptoms you might experience, and the different methods we can use to treat it. A sore throat is caused by either a bacterial or a viral infection of the surrounding tissue, causing symptoms like a hoarse voice, cough, and difficulty swallowing. They can also make us feel generally unwell, with symptoms like a headache, sickness, and tiredness. Viral infections, although troublesome, tend to be milder and are more likely to be accompanied by a cough. In the vast majority of cases, the sore throat is caused by a self-limiting viral infection, and symptoms are normally gone within a week. Bacterial infections of the throat tend to be more severe, making us spike temperatures and giving us swollen glands in our neck. Another good sign is if you can see white pus collected on the tonsils, it is more likely to be caused by a bacteria. When it comes to treatment, there are a few things we can try. For all infections, it's important to stay rested and drink plenty of water, as this will help ease the symptoms and allow your immune system to function at its best. For bacterial infections, we can use antibiotics to support your immune system in killing off the bacteria. However, in most cases, these infections are viral, meaning that antibiotics won't be effective, and we need to allow our own immune system to fight off the infection in its own time. Painkillers like paracetamol and ibuprofen can help control symptoms like fever and headache, and there are over-the-counter remedies like gargles and sprays that can help with the soreness of the throat. Sometimes antibiotics are given for viral infections, which can be bad for our health for a few reasons. Firstly, like all medications, antibiotics can have side effects such as diarrhea, vomiting, and headaches, which can make the viral infection worse. Secondly, they can cause antibiotic resistance, which is when the bacteria become accustomed to certain antibiotics, creating drug-resistant bugs that may cause infections in the future that are harder to fight off. If you are worried you have a bacterial infection, or if your symptoms aren't going away after a week, or you're feeling particularly unwell, then please come in to see a doctor.
Diarrhea is one of the most common symptoms people experience and can really disrupt our day-to-day lives. Today, I'll go through some of the causes of diarrhea, the other symptoms you might experience, and what we can do to treat the underlying disease. There are many causes for diarrhea and vomiting, including inflammatory bowel conditions, diabetes, thyroid dysfunction, and food intolerances such as celiac disease. But perhaps the most common cause is infection. The vast majority of infections will be caused by a self-limiting virus, but in some cases, a bacterium or rarely a parasite may be the culprit. In viral stomach bugs, you may experience crampy tummy pains, vomiting, and feeling generally unwell with things like tiredness, headaches, and temperatures. Symptoms usually last only 2 to 3 days, but can take up to a week to clear up. Symptoms can persist even when the offending infection is cleared. The bowel can remain irritable and produces more mucus, which can cause ongoing diarrhea, which may last a few more days. If you notice blood in the diarrhea, if you've travelled to a different country recently, or if your symptoms have lasted longer than a week, it may be a bacterial diarrhea, and we'd normally send a sample to the lab to investigate this further. In combination with blood in the stools, if you've noticed any unintentional weight loss or any masses in the tummy, these could be signs of something more worrying, so please come in to see your doctor to get checked out. Diarrhea and vomiting can cause us to lose fluid from our body, in some cases making us dehydrated. dehydration is easily reversed by drinking plenty of fluids. But if we're unable to keep fluids down, the dehydration can get worse and can make us more ill. Signs of dehydration include tiredness, lightheadedness, dry mouth, and passing small amounts of dark urine. In terms of treatment, there are many things we can do. The most important thing to do is drink plenty of fluids. The best way to do this is to have small amounts regularly. This will stop you from getting dehydrated and will strengthen your immune system to help it fight off the infection faster. If you're over the age of 60, we recommend rehydration drinks as well, which are sachets you can buy at the chemist that contain sugars and salts that help your body absorb the water better. Try and have small amounts of food if you can, but a good general rule is to follow your appetite. If you're not hungry, just don't eat. Medications like paracetamol and ibuprofen will ease the tummy pain and the headaches. In rare cases, your doctor may ask for a stool sample to identify if there is a bacterial or parasitic cause for your symptoms. If antibiotics are given for viral infections, this can be bad for our health for a number of reasons. Firstly, like all medications, antibiotics can have side effects, such as diarrhea, vomiting, and headaches, which can worsen the infection. Secondly, they can cause antibiotic resistance, which is when bacteria become accustomed to certain antibiotics, creating drug-resistant bugs that may cause infections in the future that are harder to fight off. If you've noticed blood in your stool, if you've travelled to a different country recently, if your diarrhea isn't going away after a week, or if you're unable to keep fluids down, then please come in to see your doctor.
A cough is one of the most common symptoms we might experience. This video will outline the different causes of a cough, the symptoms that it commonly comes along with, and what we can do to best treat it. Many people associate a cough with a chest infection, but there are many other causes for a cough, such as viral illnesses, heartburn, asthma, and nasal congestion. Viral coughs are very common and tend to affect the throat and the larger airways. Symptoms you might experience in viral coughs are coughing up phlegm, fever, or a high temperature. Sometimes a sore throat and headaches are associated with this. These symptoms commonly tend to peak after a few days, then they gradually get better. Unfortunately, the cough may sometimes even take up to 3 weeks to completely go away. A bacterial chest infection is an infection of the lung tissue itself, causing symptoms such as difficulty breathing, chest pain, and bringing up dark coloured phlegm. These infections will often be more severe and will most likely need to be seen by a doctor. As we have mentioned before, coughs are not always due to an infection. They can sometimes be the result of gastric reflux, asthma, nasal congestion, and occasionally something more worrying. If you've got a cough that just isn't going away, or if you've noticed some blood in your mucus, especially if you've smoked in the past, this could be a sign of something more concerning, so please come and see a doctor. In terms of treatments for coughs, there are a few things we can do. For common viral illnesses, antibiotics won't be effective in treating this, so we need to support your immune system in fighting it off itself. The most important thing you can do is rest up, take simple painkillers such as paracetamol or ibuprofen, and drink plenty of fluids. This will ease the symptoms and help your own immune system fight the infection off quicker. In bacterial chest infections, you'll most likely need antibiotics to help your immune system clear out the infection. This may be at home or sometimes in the hospital setting, depending on your age and how severe the illness is. Unfortunately, antibiotics will not help to treat viral infections. They can also be bad for our health for a few reasons. Firstly, like all medications, antibiotics can have side effects such as diarrhea, vomiting, and sometimes thrush. This can actually make us feel worse during the illness. Secondly, they can cause antibiotic resistance, which is when bacteria become accustomed to certain antibiotics, creating drug-resistant bugs. If we can catch these bugs again in the future, they'll be much harder to fight off. There are ways to prevent against getting these infections in the first place, such as if you do smoke, trying to cut down or even stopping. We know this can be hard, so please see our nurse if you want to help stop smoking. Also, if you're eligible, chest infections can also be prevented by getting the flu and pneumonia vaccinations.
Sore ears are very common, especially in children, and in most cases will clear up on their own without any treatment. However, they can cause a lot of distress, and in some cases you may need to visit your doctor for further advice. Today, I'll outline the causes of a sore ear, the symptoms you might experience, and how we can best treat the problem. There are many causes for a sore ear, such as a build-up of wax, the common cold, or changes in pressure from flying in an aeroplane or diving underwater. But the most common cause is an ear infection. Ear infections most commonly happen in the ear canal or behind the eardrum, in the middle ear. Infections of the ear canal often happen in swimmers and are most commonly due to bacteria, but in some cases can be caused by a fungal or yeast infection. Symptoms you may experience include ear pain, discharge, itch, temporary hearing loss, and a feeling that your ear is full. These symptoms typically last about a week. Infections of the middle ear are very common in children and are usually due to a self-limiting viral infection. As well as ear pain, you might experience fevers, temporary hearing loss, and just feeling generally unwell with headaches and sickness. In some cases, the eardrum may burst, causing the infected fluid to leak out and often relieving symptoms. Middle ear infections tend only to last 2 to 3 days, and burst eardrums will usually heal on their own within a few weeks. If you notice a blistery rash on the ear, weakness on one side of the face, or pain spreading to the bone behind the ear, these could be signs of a more serious infection, and it's important to seek medical attention straight away. For common ear infections, there are many ways we can treat them. For infections of the ear canal, it's important to keep your ear away from water, and we can use antibiotic ear drops to help clear out the bugs. For infections of the middle ear, symptoms will normally go away without treatment. It's important to drink plenty of fluids and eat as normally as you can, as this will help support your immune system. Painkillers like paracetamol and ibuprofen can be used to ease the pain and the fever, as can painkiller ear drops. Antibiotics are rarely used in treating middle ear infections, but may be used if your child is under 2 years old, if the infection is severe, or if it hasn't settled after 3 days. If antibiotics are given for viral infections, this can be bad for our health for a few reasons. Firstly, like all medications, antibiotics can have side effects, such as diarrhea, vomiting, and headaches, which can make the viral infection worse. Secondly, they can cause antibiotic resistance, which is when bacteria become accustomed to certain antibiotics, creating drug-resistant bugs that may cause infection in the future that are harder to fight off. If you're worried the infection is severe, if your child is under 2, or if symptoms just aren't going away after a few days, then please come in to see your doctor.
It won't be a surprise to most of us that smoking is an unhealthy habit, affecting not only us but those around us as well. However, the huge number of health complications that come along with smoking can be surprising. Today, I'll outline what happens to our bodies when we smoke, the harmful effects it can have, the benefits of not smoking, and how it can help you cut down and eventually quit. Cigarette smoke contains several substances such as nicotine, tar, and carbon monoxide. When we inhale cigarette smoke, the nicotine goes from our lungs into our bloodstream and travels up to stimulate our brain, giving us that slight head rush. Nicotine can be very addictive and can cause withdrawal symptoms such as cravings, headaches, irritability, and anxiety. If we don't smoke, these symptoms typically peak after about 24 hours and slowly get better over the course of about 2 to 4 weeks. Cigarettes also leave behind tar, a chemical residue, causing build-up and damage in the lungs and in the bloodstream all around our body, and is responsible for most of the health problems in smoking. Carbon monoxide is a chemical that attaches to our red blood cells, making it more difficult for them to carry oxygen around the body. This is especially dangerous in pregnancy, as it can limit the blood flow to the growing baby. As most of us know, there are many dangers of smoking. Half of smokers will die from smoking-related causes such as cancers, COPD, heart disease, and stroke. It can also increase our risk of things like dementia, sexual dysfunction, infertility, arthritis, and many more. In pregnant women, smoking can cause an increased risk of issues such as miscarriage, bleeding in labour, and premature babies, which are more vulnerable to disease in childhood. Parents who smoke, even if they don't smoke when their child is in the room, can unfortunately cause similar health problems for their children, as the toxic fumes from cigarettes cling to the clothing. There are many upsides to stopping smoking, and it's never too late to stop, as the benefits begin straight away. Firstly, you'll drastically improve the health of yourself and those around you as well. Secondly, you'll save a lot of money. Even cutting down from 10 cigarettes a day to 5 a day would save you over £700 a year. Other benefits are you'll start looking younger, your sense of smell and taste will improve, and you'll have accomplished something extremely difficult, but definitely achievable. There are lots of things we can do to help you stop smoking. The first step is dedicating yourself to stopping. Some people find it helpful to write a list of reasons they want to stop, as this can help solidify their motivation. It can also be helpful to tell family and friends you're stopping, so they can help support and encourage you. There are nicotine replacement medicines such as gums, sprays, and patches, which some people find helpful, and also e-cigarettes, which can contain nicotine as well. If you've struggled to quit smoking in the past, then don't worry. Most people take 3 to 4 attempts to fully stop. If you are interested in stopping smoking and making a positive change, then please book an appointment to see our nurse who can help you with this.